Hello everyone, thank you for attending today's webinar. I'm Jimmy from VO and your host today. The title of today's webinar is a restoration of basement membrane to better manage melasma in chronically UV exposed skin types. Our guest speaker is Dr. Tingsong Lim, who is currently the medical director of Clique Clinic in Malaysia. To briefly introduce his career, he has won 5cc Barcelona, AMEC, and Visage. He also has worked as a faculty at ISDS, ADAC, and ISWAM. After guest speaker's presentation, there will be time for questions which will last about 5 to 10 minutes. If you have any questions during the presentation, please type them into the question box in your control panel. Now, without further ado, we'll turn the time over to Dr. Lim.
Thank you very much. Yeah, it's great to be here. Thank you, Viol, for the invitation. I know I talk a lot about melasma, and one of the things I really like to talk about is about the basement membrane and how it has changed how I approach to manage these pigmentary disorders. And we know melasma is not a straightforward thing. It always has been a multifactorial thing. So we talk about dermal changes is due to the fibroblasts, the androgenic factors. We talk about genetics playing a part. We talk about the environmental, so the UV radiation, the heat, the hormones as well. So these are things that we have, a lot of that we have no control. And in the process of trying to manage it, I think a lot of us found frustrations because, yeah, there's tools out there that we think that it will work for our melasma cases, but most of the time, it's really out of our control. For instance, we know that the melanocytes is being triggered to be hyperactive due to the inflammation that is ongoing and for years and years of UV radiation, which most of the time we couldn't control much, except asking them to be on their sunscreen most of the time. And then as they age more, the skin, or due to using a lot of products out there or even treatments out there, their basement membrane became a bit more fragile and disrupted. I think it makes the management even more complicated. And we know that the aging of the fibroblasts also contributes to all these hyperactive melanocytes as well. So when we want to target and manage melasma, we have to put all this into considerations. And it becomes a bit more trouble for a lot of us when we are using a single modality, because we know that, yeah, a lot of growth factors plays a part. And then the inflammatory cells, like your mast cells, sort of contributes to a lot of these growth factors that contributes to that. Androgenic factors definitely play a part. And we always say that the abnormal blood vessels due to inflammation is the one that is triggering all this. And of course, one of the things that what I really want to talk about is the basement membrane. And I think basement membrane has a big role in this. We know as we age, the lamina densa becomes thinner with aging, but it is more important in terms of melasma because when we look at people who actually have these pigmentary disorders and melasma, you see that there's damage in the basal membrane on the areas of the lesional areas comparing to non-lesional areas. And we know that if sometimes when we do a lot of lasers or a lot of energy-based devices, the heat and the amount of disruptive energy could actually break this basement membrane and cause it to be worse. And the other thing that we also talked about earlier was that the senescent fibroblast contributes to the instability of the melanocytes, and therefore we do see that the areas, if you actually kind of work on the fibroblasts a little bit, the pigmentary disorder or the melasma actually gets better. So in the past, when we always follow what was given to us, especially in Southeast Asia, the biggest problem is, or South Asia per se, is that when we start to look into perimeters that was introduced to us from the West or from the East Asia, where they might not have as much as UV radiation comparing to our part of the world, because most of people in our part of the world is chronically exposed to UV radiation, and you realize that we sort of come into sort of hit a wall, because at one point it's not clearing up, and when you do a little bit more aggressively, you can actually get the multiple hypopigmentations, which we see in most of our darker skin types. And one of the things that really make us, give us a lot of trouble is when we think that these patients could do very well with our lasers, and in the end, we are creating more trouble for them. That is definitely something that we don't want to have in our practices. So of course, in the older technologies like using IPLs, or you can actually cause more disruption. And when you go too strong on it, you can actually get a lot of disruptions in terms of skin barriers as well as the basement membrane. So when we started having picosecond laser, as we know that it has lesser thermal damage to the skin, it really sort of give us a lot of encouragement, because we were stuck with our older nanosecond lasers, and having that lesser thermal damage and able to clear our pigments even better definitely gives us a lot of hope. But as we started doing more and more of these cases, we realized that there are some who did very well with the picosecond laser, and most of the cases, even with picosecond lasers, you kind of hit the wall as well, because there are clearance, but you cannot. So the minute you stop for a certain period of time, the pigments comes back. And these are things that actually sort of trouble us as well, because we promise our patients saying that, okay, because of this picosecond laser, you will get better. But when they come back again and again, you're sort of stuck in the loop. And patients will ask you, how long more should I be on this routine? And am I going to have these lasers forever, for the rest of my life? And this is where I think in our part world, when Silphone came in, I think one of the things that really sort of impressed me was how this technology has a selective coagulation towards certain structures in the skin, and especially for the basement membrane. So when we know that there's a selective stimulation towards basement membrane, taking all the abnormal blood vessels that is causing it, at the same time has a component of stimulating the fibroblasts, is definitely something that we are very, very keen to have. And one thing that I really like about this is that it doesn't have what we call the downtime is quite minimal in that sense. So what this Silphone supposedly to do is because of its pulse radio frequency. So it's different from the microneedle that is available out there. And a lot of people think that it will work the same. But for me, I think this has its definite edge because of the pulse radio frequency that you can sort of stimulate in such a way without causing the damages that you see with a continuous wave, continuous radio frequency that you see with other microneedle devices. So with that pulse form, because that is going on small pulses, it just kind of stimulate rather than destroying or creating too much heat on the skin area, as we have seen in the histological findings that it does sort of stimulate and improve the basement membrane after the silphone treatments. And you also see in the microscopic findings as well. And this is one of the paper came out with the group by Tingsong Lim and the whole group that realized that this can actually work on refractory melasma using this microneedle pulse radio frequency. How I see that it contributes to our practice, especially those who are chronically exposed to UV radiation from very young age, is that this microneedle pulse radio frequency acts to restore back the degenerated basement membrane. It eliminates the abnormal capillaries that is contributing towards the hyperactivity of our melanocytes. At the same time, because of its pulse form and its radio frequency, it does rejuvenate the fibroblasts without causing too much of damage to the other parts of the other structures in the skin as well. And when we first started sort of playing with this device, is we look at all the cases that we have and start them only on silphone, and to see how much of improvements when they only use silphone alone. And we saw that when people do silphone, that the skin quality is improved. I think it's due to the fibroblast stimulation. At the same time, it also calms the skin down because you're taking a lot of this abnormal capillaries away. I think it sort of calmed down the inflammation that's ongoing. And at the same time, it reduced the redness that is happening with the patients. So one of the things that was very interesting for us is that not only that we see that the redness goes away, the pigments sort of reduce a little bit, there seems to be some firming effect that we like to see, especially on the areas that, for instance, the forehead and also the upper eyelid, which we generally do not have much of devices that we actually work on it. And those, because the silphone doesn't have downtime and generally a bit of redness, and they generally can go back to their normal routine. I always like to use silphone as one of my base to kind of help improve the skin quality and helping patients achieve that kind of skin improvement or skin rejuvenation that's there. The other thing that we also noticed that is also the pore size has decreased. So, but when you have cases with melasma or pigmentary disorder, I think silphone on its own will take a very long time. And of course, in countries like Malaysia, most of our patients are very impatient. They really want to see some improvements throughout the treatment. So we do combine with our picosecond laser. And this is where we see that those cases which we have been having trouble to manage, especially those melasma cases, which is refractory to the nanosecond lasers or even picosecond lasers, or those who have been burnt in the past. That means they have done other lasers outside and they haven't been able to control very well. In fact, the lasers have caused more PRH and also darkening of the skin after that. And the other ones are actually those who are on a lot of different skin cares and also medicated creams that causes the skin to become a little bit more irritated. And those we see benefit from a combination of silphone and also picosecond lasers. These are some of the cases that I am showing. This is one of patients who have done nanoseconds in the past with a little bit of hypopigmentations, as you can see over here. And what we have done is that by using picosecond lasers together with silphem, you can control the hyperpigmentations at the same time to restore back the skin quality, so the hypopigmentations is not so obvious. And we also work on those superficial, those mixed pigmentary disorders where they have superficial and deep dermal pigmentations that you can actually sort of fix it together. At the same time, trying to minimize the harm, because most of the time when we actually try to do a bit more aggressively, I think what we can cause is more deeper PIH that's it's forming while clearing up the superficial pigmentations. And if you can notice in this photo as well, that the skin quality is way better. Even the pores has improved, and also there seems to be some firming along the way. This is without any other devices that helps in terms of firming. And this is one of the cases I generally bring up. Is one of clients who have done lasers long time ago. I think she claimed it was an IPL. And what happened was, after the few sessions of IPL, the pigmentations became worse, and she had it for about 4 years. That she was actually having social embarrassment. She couldn't go out. She was actually very depressed. And finally, she found us, and we managed to help her with the combination of picosecond lasers together with silphem. And I think one of the contribution is that because that she had a really bad count where the burn is there, and of course with lots of sun exposure, which is not helping. We managed to kind of get her into restoring back the basement membrane and also clearing up the residual pigmentation that is stuck in her. So these are the before and afters that we did for her. And in fact, now she's her hyperpigmentation is well under control. There are many cases that we've seen great results with it. And again, when we actually combine silphem with our toning lasers and picosecond lasers, you realize that the pigments doesn't come back as it used to be, because no matter how you clear the pigments, when you don't control the root cause of the hyperpigmentations, I think it's just a matter of time. They'll come back and say that, well, it looks great initially, but I think it's all back to square one, and we have to go on and start all over again. So these are cases from superficial to deep hyperpigmentations, as you can see here. Even with adenome, we managed to kind of clear it without having to do very aggressive treatments. And I think it's one of the ways that we can sort of prevent some of patients who are going into sort of PIH because of the broken down of the basement membrane when we try to be more aggressive treating this what we call difficult melasma cases. And one of the things that here is one time picosecond laser with one silphem. She's the mother of one of staff, and we can see that the skin quality definitely has improved, as well as you can also see how it helps in terms of the hyperpigmentation and skin quality that we have here. And what also in this case, we were treating the hyperpigmentation, but at the same time, we realized that because this patient has a bit more of the hyperactivities in terms of oil glands, as you can see here, the milia improved. Some of the acne is actually improved. And this is interesting because even the pores improved. So we were looking into maybe by using this, because we know that using pulse radio frequency, there's a few structures that it become more selective. One is basement membrane. The other thing is that the abnormal blood vessels. So blood vessel walls, the capillary walls is one of the areas that we have so-called the change in terms of the density of the tissue. That's why the pulse radio frequency generally works on those. And one of the things is also your hair follicles, which is around the hair follicles, the oil glands, where the oil glands are. And I think when we work on the silphium with the pulse radio frequency, it also selectively working on our sebaceous glands and sort of control the oil glands activities of the face. And this had led to us looking into working on patients who want to work on not only redness, but also on the hyperactivity in terms of oil glands and improve the skin quality. And of course, here we also see the improvements in terms of pores because of that, and also trying to control a lot of acne issues. And we have actually looked into those who have very oily skin type, and it seems like it has improved. And also it works on those who have dark eye circles as well. We have seen improvements in these patients as well. So for younger patients who have very active oil glands, who have acne issues, we start working on them, and we realize this actually works, not only reducing the redness, but also prevent new acne from forming. And we start to work on all the patients who have acne issues as one of the things that will help them improve their skin quality and also prevent scarring from happening. And this is one of the patients who actually have really bad breakouts, and we managed to kind of control it nicely. And because when we work on acne, active acne, we also see that some of their scars, acne scars, seems to be improving as well. And it's not only the redness, but we see that the skin seems to be a bit softer, and then the uneven skin structure seems to improve from there. And we start working on acne scars among our patients as well. And these are some of the before and afters of the acne scars that we use the silphium and in our patients. And one of the things that we also see is that among older patients, when they have a lot of wrinkles and fine lines, we also find that because of the stimulation of the fibroblasts, you do see improvements in their skin quality. And this patient did not do any skin tightening treatments, but because of using silphium, it has improved that as well. So it's kind of short. I think I want to open this platform to more discussion. So I'll give back the podium to Jimmy. Thank you.
All right, thank you, Dr. Lim, for the great presentation. Especially, we love to see your great results of silphium treatment. So now we'll go ahead, take some time for questions. So do you do any special post-treatment care after melasma treatment with the silphium?
Yeah, I think so. I didn't really mention my protocol earlier. I think one of the things that a lot of questions to ask about how I treat my patients. I do a picosecond laser, and then after two weeks, I will do my silphium treatments, and then 2 weeks after, I'll do my picosecond laser as one of my routine. It's a general way of controlling that initially. If the thing is being controlled, then I might stretch my so-called frequency a little bit and have a longer interval. So like what you mentioned earlier, the post-treatment care, I do ask them to be on sunscreen because we are actually trying to repair all the damage that has been done in the past, and not to actually have more damages as we go along. But sometimes skincare itself, the sunscreen is not enough. So I do ask them to have more physical, so-called blocking, like wear hat, wear long sleeves, wear something that you can cover. Try not to go exposed in 11 to 4 o'clock daylights where you can actually cause more UV radiation. And the other thing that I also sometimes, if it's really bad cases, I'll ask them to be on some medication like tranexamic acid just to kind of control the abnormal capillaries from forming.
All right. And the combination therapy with the cell foam and picosecond laser was the second question you just answered with the protocol. Yes. And the next question is, normally how many sessions you recommend for melasma treatment?
I would suggest, that's a good question. I normally suggest from what I've seen in our patients group, I would say the basic is at least 6 times of picosecond laser together with 6 times of silphium. That means it's 12 times of treatments. If they are really bad in terms of, it seems like it has been, the basement membrane has been really damaged. You can see that it's a whole big patch of melasma. I would suggest them doing a bit more frequently initially. And then sometimes I also ask them to be on medication immediately. But if time permits me to they can come for treatments, I'll still advise not to do on the same day. That means don't do picosecond laser and silphium on the same day, but stretch it out. So one of the questions that I think people will ask us as well is, which one do I start first? Actually, you can start whichever you want, but I generally like to start with picosecond laser because at least they see some improvements initially, and work on the silphium 2 weeks after, and then pico and silphium. Yeah.
All right, and the next one is, I know melasma is difficult to treat, but generally, when can the patient see some improvements?
I would think that that's a good question as well, as you mean. I think most patients will see some improvements at least on the 2nd or 3rd rounds of treatments. What I also tell them is that the clearance that they normally see from it's actually because the picosecond laser sort of clears the pigments away a little bit. But the silphium is the one that is doing the foundation work. So a lot of times when they say, I did my silphium, I don't think I like it because I don't see any improvements after my silphium. And that's a common misunderstanding with patients. Is like, when I do this, immediately I need to see some results. And I don't think so, because the problem with using silphium is it's working on the root cause, it's working on the fundamental of the issue. So they might not see immediate results, but when they have done enough of silphium, in all cases, they will definitely see changes in qualities. There seems to be some glow with the skin. The pigment seems to be in a better control compared to earlier. And I think these are things that we can always kind of hold their hands and reassure them. And for me, generally, if they're done about, say, 4 times of silphium and 4 times of pico, definitely they will see some improvements, lightening of pigmentations, the redness is gone. And also it seems like you can stretch a bit of your treatments without having the pigments coming back so easily. And I think that is where you kind of want to sort of have a cut. That means when it comes to the 3rd times that you do your pico and silphium, if you haven't seen much of improvement, maybe you need to kind of revisit your treatment protocols and start asking some experts what could have gone wrong.
All right. And can you share your treatment protocols for melasma? I think it's meant to be the parameter settings.
Right. So I would say most of us kind of have difficulty in terms of trying to find that correct parameters to treat. For silphium, I tend to go on 0.8 millimeters, and my power remains on 3, and my speed is on the max. That means my speed is on the 3rd level, which is the fastest. So I think, because when we first started trying out with 1.5 millimeters, what happened was some of patients seems like the skin became a bit darker. I don't know whether it's because that it's called incidental, or was it maybe because it's too deep for some of patients and didn't really see very good results with it. Therefore, when we find we kind of drop down to 0.8 millimeters in terms of the depth of the needles, we see more results that is promising. So that's why we kept it at 0.8 millimeters. And the power, because I think even with 3, it's already doing a good job in terms of stimulating. And this is where I think less is more. The minute that we go too high in terms of power and too deep in terms of needles, you can actually disrupt the basement membrane and cause more harm rather than doing the stimulation that you need. And for the toning laser, like picosecond lasers, I still keep it as a big spot size and also moderate to low power, not too strong, and to kind of tone the skin, even though you don't need to come down to the endpoints that we all talk about. And still, the results will be better. With time, you realize that because you're not creating too much of a heat damage, that the thermal damage is lesser, and then it's the whole progress in terms of getting better is much faster.
All right. For silphium treatment on the melasma patient, how do you adjust the parameters? Like for example, the patient has dark skin types, or that patient has in a sensitive skin, then how would you adjust the parameters within the needle depth or the energy settings?
Yeah, that's a great question. Yeah, in fact, I would say if you want to go in terms of trying to kind of tweak the treatment protocols according to individuals, I will start with still again 0.8 millimeters and power 3, and then I say go along. If I realize that this patient is not seeing a lot of improvements, either I repeat on the certain areas a bit more. That means I'm using the same parameters and kind of do a overlapping on those areas, or I might go up a little bit in terms of energy and depth. And this is also depending on that patient, because yeah, you're right. There are patients who come in with very thick epidermis where you realize that it's not going much anywhere. You want to go deeper. In terms of power, I will be a bit more cautious, because the last thing I want to do is create more thermal damage and creating more disruptions in terms of basement membrane and more inflammation of the skin.
Okay, and what would you do if the patient's skin type is 5? Like
5.
yeah, then energy setting?
Yeah, for darker skin type, even if you have 5 and 6, definitely I will keep on to my baseline of 0.8 millimeters and also power 3. Because we do treat a lot of South Asians here in Malaysia. We do treat them, and I think 0.8 works for them. So far, I haven't had any so-called problems with these parameters at the moment.
So basically, you stick to the parameters that you use in general.
Yes, that's true.
Okay. And how many passes you perform?
Normally, 1 pass is sufficient. But if you find that there are certain areas that you kind of want to treat a little bit more, I do overlap a little bit, just to kind of get the results a bit better. If I feel like that place it's undertreated, I would just kind of overlap. The most is 3 times And that means, yeah, if you look at these lesional areas and you say like, maybe one pass is not enough and you kind of want to go on the second pass, third pass, I think it should be okay, but try not to overdo it. Like I say, sometimes less is more.
All right. And, one of the audience asks, what is the average shot count per treatment for melasma?
Shot counts, you mean like for the full face or?
Yeah. On full face.
Okay.
I think, yes.
Okay, I have to admit, I never really look at how many shots I did. For me, it's just looking at a face, and I do cover up to the neck. I would say, yeah. So somehow when I was doing it, I generally do not look at how many shots I do.
Yes, you're right.
But for me, it's more on how the skin reacts. I think so when you pass through the skin initially, you won't see much of redness, you won't see any reaction.
Yeah.
But when you leave it for a certain period of time, let's say you do half a face up to the neck on one side, by the time you reach the other side, you'll start to see the areas that you've been through turn a bit red already. There's some very mild erythema, and I think that is good enough. In fact, most of the time, I'd rather let them. So most of the time, it's one pass, and then I let them go and try to kind of not overdo. And the other trick that I also do is when after the treatments, because we are doing micro needle on the face, if you want, you can put on some tranexamic acid liquid on the face, or any medicine that you want to do so-called transdermal kind of application in terms of medication. You can actually do that after your silver.
Okay. And can you explain about the mechanism of selective coagulation and how does it differ from continuous waves?
Right. Okay. This is another thing that is very interesting. So when we have continuous waves, that means the electrons are moving towards a direction. It's just continuing of energy flow towards different structures inside the skin. But when you actually make this radio frequency in the pulse form, the electrons are pushed in certain ways that it will actually reach a differentiation in terms of density. And when there's a density difference, some of the electrons accumulate on the side because the flow is now not a continuous movement of these electrons. And what we see is that when it's a pulse form, some of this electrons sort of accumulate on on the barrier where you have differentiation in density. And this is something that actually Dr. Na shared with me when I was listening to it. I find it very fascinating that the barrier difference in terms of this soft tissue density changes happens at the basement membrane, at the capillary walls, as well as the hair follicle areas. And because of that, I think that when you accumulate enough energy around it, and it's not that so-called high energy where it becomes disruptive, it can actually either stimulate or it sort of unstabilize that structure. If the structure is not strong enough, for instance, the abnormal capillaries, because the structure is not strong enough, when you have that kind of accumulation energy on those areas, it becomes destructive. But whereas on the area that you have more in terms of like, if you have basement membrane that it's a bit more fragile, it sort of stimulate that it can create, it can actually rejuvenate that at the same time. So I think that works for a lot of, so it's really nice in that sense that whenever you have that differences in terms of soft tissue that is not the healthiest soft tissue, you can actually be more selective in that sense, rather than when it's continuous wave, it become non-selective. That means even healthy tissues can also become part of the structures that being sort of having the energies being targeted on them. The other thing that I also find very interesting in terms of scars is that most of the scars tissues that went through silphium, I find it has softened. And my belief is because that there's a lot of structural changes in terms of those scars that could be part of the tissues being selected as part of treatments for silphium as well.
So I think it's time to wrap up. So please feel free to contact us at the email address shown in the next slide if you have any inquiry about today's webinar or the device silphium. Just to let you know that you will be able to reaccess today's webinar on YouTube after 1 or 2 weeks. A big thank you to our special guest speaker, Dr. Lim, for his great presentation. And also thank you to the audience for taking time out of the busy schedules. I will look forward to seeing you again at next webinar.